recording. You are being recorded now. Don't do anything on camera that you don't want to end up on YouTube. Just gonna wait a little bit for a few more folks to roll in.
Hmm, think. Can somebody say something?
Hello?
Hello.
Dang it. There we go. I can hear you.
You got it?
Yep. Headphones ran out of batteries. All right, let's see. We have a web accessible version of the agenda, but I don't know where it is. So I'm just going to share since screen readers can't read YouTube anyways. I don't think we'll be out of any kind of compliance. Can you see that well enough to engage with it? Okay. Um, view four. This is not one that I can type into, but let's see. We have on a day, we have Selby Stebbins, we have Courtney Esparza, Corinne Hale. We definitely have 5 people. Uh, 5 people who are voting members, which is what we need for quorum in order to start. Um, we have our co-chair, Leah Tucker, here. We also have some guests, and Ebony Clark, our other co-chair, is required to be at another in-person meeting today, so it's just the Leah and Anna show today. Um, Leah, I don't know if there's anything you want to say to start kicking off the meeting, but feel free.
Nope, I am good. I'm going to let it be the Anna show today.
Oh, fun. Yeah, Leah is still recovering from a pretty nasty cold, so unfortunately for you all, you're just gonna have to hear me talk a lot today. Um, And I see your question, Leah. We are looking for a state partner, but from an implementation standpoint, there's some value there. If we are unable to find somebody who can step into that role, we would be excited to fill them with a strong advocate in that space who maybe knows how to move and shake, even when they don't have the authority to do the things on behalf of the agency. Make sense? Okay. Okay, so I'm going to start with a quick overview of our agenda and our group agreements. In fact, I'm going to flip the order of those because our group agreements are on the screen. You may notice a little bit of change from the last time we were in this space. Um, uh, the executive committee at the System of Care Advisory Council made a few edits to these group agreements. So, group agreements for this space are to be present and participate to the best of your ability, to treat others with respect, which looks like avoiding interrupting and using the name and pronouns people prefer to be called by. We avoid acronyms to try for clarity in our conversations. If you screw up, no big deal. Use the chat box to ask for clarification if you don't know what the acronym means, or you can be the eager beaver and define the acronym and see if you're right. Sometimes it's fun to see the different ways that different acronyms can all be defined. So please do hop into the chat box if somebody accidentally uses an acronym, and let's make sure we know that we're all talking about the same thing. Varied and opposing ideas are welcome. In fact, we are solving difficult adaptive problems, and varied and opposing ideas are necessary. Rather than taking it personally when someone disagrees with you, if you can try to be curious about that disagreement and learn more about where they're coming from, I think we will get a lot farther as a team. Honoring those with quieter voices, those of us who tend to talk a lot, uh, challenge yourself to lean back a little bit and create more space in the room for those quieter folks. those of us who are quieter, I'm not one of them, lean in a little bit. You're here for a reason, and we definitely want to hear from you. So use the chat box. If it's just like, I can't make it come out of my mouth, chat it to somebody else and ask them to say it for you. But you're here for a reason, and we definitely want to hear what your perspective is. So lean in the way that works best for you. Um, Avoid problem solving for individual situations or crises. This meeting is really focused on system level issues. That said, this is an incredible network of humans who know all of the resources that may not be available. So if you are struggling with something that you need some case support on, please do feel free to reach out to me or to the other SOCAC staff. We have peer support available to help you navigate systems. We don't want the system itself to be a barrier for you to be able to participate in system change. Focus on our purpose, improving the system of care in Oregon. Be mindful of power dynamics in the room, and that's a sentence we could spend all day discussing. And do your very best to avoid harming others. When that happens, which it often will in these difficult conversations, do your best to be open to repair, particularly if you're the person who is identified as causing the harm. Intent and impact are not the same. So coming together and trying to figure out how we repair that rift is really, really important if we're going to keep doing this difficult work together. Questions or comments on our group agreements for today? Okay. Our values, we center in this space, we center children, youth, and families. We increase awareness and reduce stigma to the best of our ability. We strive to promote sustainable change in the systems that we're here to improve. We prioritize community-based care and support communities in caring for one another. And we advance equity by promoting accessibility, affordability, and quality. And if you have a copy of this agenda, that's a link. It takes you to our equity tool, which is published on our website. And I have a copy of it right next to me usually, but right now it's in too many piles on my desk. So I was going to just hold it up and show it to you. I do refer to it all the time just to keep ourselves grounded in our equity strategies. At our last meeting, we reviewed the charter for this group, and there were some specific suggestions that came from a few different people. I did make those changes in the charter, and I sent that out via the updated agenda today. However, it is not on our agenda to cover that today. So if we end up with extra time, I'll hop into the charter and show you where I made the changes that you all recommended. If not, Leah, let's do our best to remember to get that on the agenda for our next meeting, that we can just finalize that charter and make sure that folks are feeling comfortable with it. Does that feel okay to folks? And I promised at the last meeting I would bring the charter back to this meeting, and I then did not put it on the agenda, so sorry. Okay, let's go around the room and do our names, our pronouns, your role on the committee. We won't always do this long sort of introduction thing, but we're in a sort of getting to know you phase, and new people are continuing to be added to this group. So we have some new members this time that weren't at our last meeting. Want to make sure that we know who they are, what their role is on the subcommittee. So if you are a education representative or a lived experience representative or a subject matter expert in a particular subject or agency representative, just go ahead and let us know that that's the role you're here to play. Does not mean that's the only thing about you that we value in this space. And then one goal that you have for our shared work as we move forward into action. And I'm just going to call on people because I find that goes faster. So, Christy Hudson.
Hey everybody, I'm Christy Hudson, she, her pronouns, System of Care Transformation Manager, and here as staff.
Anna.
Hi all, I am Anna Day. I use she, her pronouns. I am the Executive Director at Oregon Community Programs in Lane County, where we do outpatient behavioral health for kids and families and therapeutic foster care. I also work with the Oregon Alliance of Children's Programs. So I am here. I'm not exactly sure what capacity I'm in here, but this is my very first meeting, so I'm sure I will get oriented and appreciate working with y'all.
Thanks, Anna. Selby. Oh, and you're here as a provider, subject matter expert, Anna.
All right, I'm a provider, subject matter expert. Thanks all.
Hi, my name is Selby Stebbins. I use she, her pronouns. I'm based at Health Share of Oregon in Portland. I support the Tri-County system of care, so that's Washington, Multnomah, and Clackamas County. We also Trillium Community Health Plans is our second CCO in the region that supports that work. And I worry sometimes people, say it's all about Portland being the population center, but I want to acknowledge we actually do have rural areas in Washington and Clackamas County and even far East Multnomah County. And so I try to bring in that wider ranging perspective of our tri-county region and the different things our families experience across the region. Thank you.
Thanks, Selby. Courtney.
Hi, I'm Courtney Esparza. I'm the Behavioral Health Director for Trillium Community Health Plan. I also serve on the SOCAC as one of the CCO representatives. She, her pronouns. I think one goal, I've said this in other meetings, but I feel like a personal goal of mine is to when I'm in these shared spaces related to SOC and SOCAC to really be able to be present and not resist the urge to multitask. It's something that's, yeah, I find challenging. So yeah, I just really want to be present and be a listening active member, not somebody that's halfway listening and multitasking. So
Thanks, Christy. Courtney, and I'm sorry, Christy's little heart popped up and I read her name. And that's a good reminder for all of us. And thank you for calling us in. Debbie Martin.
Hello, I'm Debbie Martin. I work with the Oregon Youth Authority, so I think I'm an agency rep and juvenile justice, along with Sonia, if she's here, I'm not sure. And I use she, her pronouns. I guess a goal that I have for this shared work is as I'm doing more policy legislative work for the agency, just really looking for those opportunities to make sure that youth in our system in particular, but in all systems, have no barriers to the services that they need. I just feel like sometimes kids that end up in juvenile justice, they kind of end up in this vortex where they don't really fit nicely in this system or this system or that system, and they kind of get caught in the middle. And so I would love to see how we can take out some of those barriers to not have them have to just be only in one system to get services. I don't know if that makes sense, but that's what I got.
Oh, with you, Debbie. Yes, there's a bathroom at it doesn't even matter where, downtown Portland, where we have meetings sometimes for the governor's office, and you walk in and then it's this tiny room and there's all these doors around you and they all have codes on them. And I feel like that's like this great analogy for our system that like you finally get through the door and then it's just another hallway full of doors and you don't have the code that you need to get through the next door, right? I feel like kids in juvenile justice are like just through that first door, but then all the locked doors are just what they're standing there looking at. So
100%. That's a great idea.
I took a picture of it, but it's
it
not
makes
as
me want to
visual.
make sure, like, I feel like I need to know where that building is so that I never go there. So
It's the Portland World Trade Center. That's what it is. It just popped back into my. Leah.
And I knew you were going to call me next. So, I am Leah Tucker. I am the co-chair for this group. I am also a family advocate, family representative for SOCAC. And I'm really just here to, work on and push for kind of the things that I hear in the family groups and in these groups, and just add that voice, I hope, to the conversation. That's really all.
I wish you wouldn't diminish it, but like that, Leah. It's critically important that we have family voice in the space.
It's
Corinne.
Hi all, I'm Corinne Hale. My pronouns are she, her, and I work with Columbia Pacific Coordinated Care Organization, overseeing Tillamook, Clatsop, and Columbia County. And I sit in this space, serving as that system of care rep for the North Coast. And a goal for me is just essentially what everybody else said, just honing in on that speaking truth to power. And I feel like system of care is a really great space to build those skills, have fellow peers who are also trying to speak truth to power, and just kind of honing in our truths to make change for children, youth, and families.
Love it. Glad you're here. Jared.
Hi, all. I'm Jared Hayes. I'm the Director of Special Programs in Clackamas Education Service District. Just a quick overview of the programming we do in our department. We support students not only in Clackamas County, but actually throughout the region. I would say the Quad County area. So we have our Heron Creek program, which is students with, it's its own special school, students with high social emotional behavioral needs. And we're actually working towards getting day treatment certification there for this next year as well. We also have a life skills program for students with complex communication and cognitive needs. We have classrooms all throughout Clackamas County. And we also are the host educational agency for Parrot Creek, which is a residential program traditionally had been for students stepping out of juvenile detention. And they also added two new programs, one for students with substance abuse and addiction challenges, and also students experiencing really challenging foster care scenarios. So we have I would say the highest of the high need in terms of acuity, and our parents and family givers, caregivers need a lot of support too. So I'm here to make sure to inform and get ideas from you all too, because we need to support these families and students as best we can.
Thanks so much, Jared. And one of the things that, so Jared is new, he wasn't here at our last meeting. They are doing some of that cross systems work at the Clackamas ESD that we are talking about. And so while you're here to learn, you're also here very strategically for us to learn from you and the challenges that you've already figured out how to get over and around so that maybe we can support others in doing similar work. So really grateful to have you here. Nate.
Hello, thank you. Hello, everyone. My name is Nate Latanzio. I use he, him pronouns, and I'm a Youth Advisory Council Coordinator at Youth Era. And I would say one goal I have for our shared work in this space, like I guess like more on like a personal level, but also professional in a way, like something that I've really been trying to focus on, done a lot of direct service with young people in my career to this point, training for youth peer supports, and now like a lot more of this advocacy piece. And like just one of my big goals is just to really get like a first principles understanding of how youth services come to be, from policy to funding to all of those things. I'm definitely out of my depth frequently, but I'm working to not have that be the case forever. So thank you.
Really grateful to have you here, Nate. Wes.
Hi, everybody. My name's Wes Rivers. I use he, him pronouns. I'm a senior policy analyst with the Alcohol and Drug Policy Commission. I am here to serve as liaison from our agency and to support the shared goals of ADPC and SOCAC with respect to youth substance use disorder, and bring back any specific commentary from our youth led council, the Oregon Youth Addiction Alliance, to this space as much as possible, and then just basically support SOCAC's broader strategies.
Awesome. Grateful to have you here. Lydia.
Hi everyone, my name is Lydia Fluger. I use she, her pronouns. I'm the Continuum of Care Coordinator on the Treatment Services team in child welfare, and we support youth with complex or specialized needs across a continuum of care of services, from family-based settings to residential settings, as well as individual services. And I'm here, one of the state agency reps for child welfare. And for me, a goal is just continued shared alignment across different state agencies and partners on our shared goals and priorities and working towards that. So it's exciting to see many folks that I've seen in other spaces as well.
Awesome. Always good to have you here. Remy.
Hi, Hi, everyone. My name is Remy Watts. I use she, her pronouns, and I am a senior policy analyst with the Oregon Department of Education. And a lot of my work is around bringing the safety and supports from our partner state agencies into the K-12 space. So I'm really excited to be here because I think that the stuff that SOCAC does is so cool and important. And I also just really love OARs and statute, which is weird of me. But I really want to make sure that the school, like whatever SOCAC wants to do, I want it to be as strategic and impactful as possible for the K-12 settings. And that's why I'm here. Thank you.
Awesome. Thanks, Remy. Monique.
Hi, my name is Monique Turner. I'm a provider and I am a child and family therapist and also working as a clinical psychologist. So I see a lot of our shared youth and families who have complex needs, and I'm always looking for ways to partner and provide resources to families and to give perspective on what I see as I'm working with those families. So one goal I have is, I think, for us to be able to work together more to provide the kinds of services that families need because it's not just one system at a time. It's a combination of systems working together to meet the unique needs of youth.
Excellent. Thanks, Monique. Alex.
Hi, I'm Alex Solis, he, him pronoun. And I feel like Remy and I need to be good friends because I am a policy nerd and I love it. So I'm excited to be here. And I would say I carry some experience in system of care and continuum of care. Sorry, we'll go with continuum of care.
And your policy nerdery is a huge part of why you were here. So yeah, you and Remy should connect and nerd out together. Alicia.
Hello, my name's Alicia Riddle, and that's okay. I'm used to it. My name's Alicia Riddle, and I use she, her pronouns, and I'm the Family Involvement Manager at Oregon Family to Family Health Information Center and the Oregon Center for Children and Youth with Special Health Needs, also known as OCEAN. And so I kind of serve two hats. I think I'm going to be, I do have lived experience as a parent of kids with complex mental health and developmental health needs. And I am also working from the agency side, working for OCEAN. And so I'm excited to be here and have more conversation. I've been involved in some of the work a long time ago in the Tri-County area. And so now I'm happy to be working with this group as well. And so I'll also be on the family engagement, or what is it, family engagement?
Family Advisory Committee.
Family Advisory Committee. And just hoping to bring that perspective to the work. And I really am invested in that intersectionality between developmental disability, IDD, and mental health, and so mental and behavioral health. So I'm really hoping to help be a voice for those children and youth with special health needs and developmental disabilities in the mental health and behavioral health space.
Thank you so much. Really excited to have you here, Alicia. And I'm sure you and Leah will connect also in the Family Advisory Committee space, but similar priorities in terms of populations of focus. Jill.
Hi there. I'm not a member, so I didn't know I was going to get to introduce
Oh,
myself.
I'm sorry. I just saw you there, assumed you were serving as like proxy for somebody, like, but if you
Nope.
don't want to introduce yourself and just be a member of the public, you can.
I'm working on behalf of OHA. So, Jill Archer, she, her. I'm the policy director and chief of staff with Behavioral Health Division at OHA. Just
Glad to have you here.
here to hear the conversation. Thank you.
Yeah. And Elliot is also a member of the public, but also like a contracted support provider for the SOCAC. So Elliot, if you are in a place where you can come off mute and introduce yourself quickly, that would be great.
Yeah, hi all. Elliot Hinkle, I use they, them pronouns, and principal and founder of Unicorn Solutions. I do a lot of work with lived experience, so helping SOCAC right now, particularly with the Youth Council in that space. And recently I've gotten connected with at least two youth who had thoughts about education. So I'm just thinking about ways to make sure their experiences or recommendations make it into these spaces. So I'm just sort of thinking about that in the background, but I'm happy to be here and listening.
Thanks so much, Elliot. And Sonia, you thought you were going to miss introductions, but guess what? You got here just in time. We are introducing ourselves, our pronouns. If we, well, yours are in your box, so you can name those as well. Your role in terms of sort of the agency or the lens you're representing on the community, and one goal you have for our work in this space together.
Lovely, lucky me. Um, hello, Sonia Little Deer Evans, she, her, Aya, and I am the Deputy Director for Deschutes County Juvenile Community Justice, and I represent the Oregon Juvenile Department Directors Rep on SOCAC. And one goal for this space, I guess would be, yeah, to build community, and then with that community that we build, be able to get some good work done.
Love it. If you want to go far, go together. Okay. I'm going to move us to the next section of the agenda unless anyone has questions, or if I missed you, I think everyone I can see has introduced themselves, but if I missed you, unmute and tell me that. Okay. So, System of Care Advisory Council had to submit, like, in our sort of weird relationship with the rest of the executive branch, we sort of got forgotten in the notices of like timelines for when legislative concepts had to be submitted. So, I know that there, particularly for some folks, some feelings about like, oh, the SOCAC does legislative work and doesn't involve everybody, and I just want to name that it might be somewhat activating that happened again. I am deeply sorry. It was not intentional. I found out on Tuesday, 2 weeks ago, that our legislative concepts were due by Wednesday at noon, or the bus was going to take off and we would not have the opportunity to submit legislative concepts. And so we put two in because we get to, and one of them is a placeholder bill, which has sort of a headline, and that's it, but we can turn it into other things if we want to. And the other is a council composition bill that tweaks just a couple of things about the way that the work is structured internally here within the System of Care Advisory Council. So if you're okay with me pulling down the agenda, I will review those two concepts for about 10 minutes. Then we'll move into small groups to talk about hopes, suggestions, specific language ideas you want to see in either or both of those. And then we'll come back out, report those topics, and be done with this particular topic in about half an hour. Anybody who opposes my stopping sharing, raise your hand. Remy, okay, I can leave it up if you want.
I'm just kidding, Anna.
Okay, so concept number one is council composition. ORS 418.295, I think. I could be making up the 295 part. Is what defines the System of Care Advisory Council. It puts us in statute. It says what the rule, who sits on the council. It says what our mission is, all the reporting requirements, all of the things. We are proposing, and this comes primarily from your friendly System of Care Advisory Council staff, to add a seat. So this would put us up at a full 30 members. I think that anything above that would be ridiculous. But 30 is doable. To add a seat, Remy, I see you getting so excited, for Medicaid. Because it's kind of ridiculous that we don't have Medicaid fully at this table and hearing these conversations and then helping us with implementation. I did check with Medicaid, and they are happy and excited to be included in the council. And then some things that and I'm pulling up the document itself right now. Some things that I want to present to you all or propose to you all is, are there other things in this statute? And I'll give you the link to go check out the statute in just a second. But are there other things in the statute that also feel like they would want to change? You would want them to change. So, for instance, the current statute requires that the System of Care Advisory Council data dashboard reports information that the children's system simply does not collect. So, like, we're out of alignment with the law just because it's not possible. Yeah. Uh, for instance, the number, and this may be something we don't actually want to change. But for instance, the number of kids who were at risk of removal from their homes who did not end up getting removed from their homes is a thing we're supposed to be reporting on in the dashboard, but nobody gathers or reports that information in a way that we can put into a dashboard, and so we just aren't doing that, right? Doesn't mean we don't care about that, and it may be that as the Family First funding comes in online that we actually are able to count that. So that's a thing to talk about. Do we want to keep it there and strive to create systems that actually can collect that data? That's a decision that we can make. It also reports here, let me share. It also would, or we have proposed that we should remove the requirement to report on the Crisis and Transition Services Program, which no longer exists, and instead replace that with something like mobile crisis response for youth and young adults, or mobile crisis response for children, right? Something that's not a program name, but that talks about defining the service so that as program names change over the course of time, we're still reporting on the thing, which is, are mobile services actually getting to kids or not? And if they're not, where and why is that not happening? That seems like the point, but it's not written in statute that way. There is language in our founding legislation that sort of broadens our scope to include every child in Oregon, children who are at risk of developing behavioral, physical, or developmental conditions. We definitely want to be thoughtful about kids who are at high risk, but I think anyone is always at risk for anything. And so maybe we want to streamline that and really continue to maintain the focus on kids with high acuity in this space, because we are the only space that really focuses on youth and young adults in the high acuity or cross system space. And would add a member representing Medicaid, which I saw your question, Selby. I'll get to that in a second. And I've reached out to Disability Rights Oregon, and I admit this is controversial, but I would like to recommend that we open up the definition of their seat to any federally designated advocacy organization in the state, which would then include Oregon Council on Developmental Disabilities, Oregon Family Support Network, OFSN. It would include FACT Oregon, right? So there are a number of federally designated disability advocacy organizations that are not Disability Rights Oregon. And I think that they may be better served not having to staff the council in the way that agencies do, and we may be better served by having some flexibility to bring in those disability advocacy organizations that are connected to whatever the strategic plan is for the years that they're sitting on the council. So those are the council composition changes that staff proposed. And then to Selby's question, she said in the chat, can you clarify between the CCO rep role and the proposed Medicaid role? So we have two existing CCO reps, one Courtney Esparza, and the other Adam Peterson. One has to represent counties that have significant urban populations, and one has to represent counties that have significant rural populations. Those are seated on the council in 4-year terms, based on an application that they submit, and then the governor choosing to appoint whoever the preferred person is that has submitted a qualifying application. The Medicaid seat would be slightly different in that it would be somebody who is a top leader in the Medicaid division at the Oregon Health Authority. So right now we're talking about Emma Sando, Vivian Levy, or Rusha Grinstead. Only those 3 people would be eligible, and it would be designated by the OHA director, which one of those 3 people would sit in that seat, and they would hold an evergreen seat, so they would not be applying. However, we would do like a courtesy appointment by the governor's office, which is the same that all the other agency folks do. So like Ebony's seat here is because she is the behavioral health director, but the governor goes ahead and appoints her formally. And then when Ebony leaves her position as behavioral health director, the new behavioral health director will also just sit in that seat automatically. So that'll be the difference, that Medicaid person will just automatically sit in this seat. Does that answer your question, Selby? What other questions do other folks have? Just for clarity before you go into small groups to talk.
Anna, when you were talking about the DRO rep and you were wanting to broaden that, I'm looking at the list in the statute of members, and I'm not sure which one are you referencing in that, just so I can kind of wrap my head around it a little bit.
Yeah, it is.
Because I see like
It is P. I'm not in the statute, I'm in the bill,
Okay.
but it is one member who is a representative of Oregon's
gotcha.
federally mandated disability. It's the protection and, which makes it only for DRO. If you just took out protection and, that
okay.
would make OCDD, OFSN, those other entities also eligible for that seat.
Gotcha. Okay, thank you. Appreciate it.
Yeah. Yeah. And then statute is ORS 418.979, and Christy Hudson, thank you so much. Put a link to the Oregon Revised Statute, or ORS, in the chat so that those of you who are policy nerds can go look directly at the language. And actually, if there's if you see other stuff in that language that you're like, this doesn't make sense, please highlight it in your small group conversation, and we can have a conversation. Also want to be clear, this is the beginning of a conversation, not the end of a conversation. So if you all are looking at the statute and we want to make changes someday down the road, we have until the bill is through its first committee in the 2027 legislative session. The intent here is to not be rushing. And then I'm trying to pull up the other document, download a copy.
Hey, Anna, while you do that, I just want to note the link that I just sent doesn't include the changes that happened in 2025. So it's still referring to 25 members, not 29 members. I think was there one other change in that 25 bill, Anna?
Yeah, youth who were appointed before their 25th birthday get to serve out their full terms instead of having to be removed from the council upon their 25th birthday. Did not mean to mute myself. And our strategic plan timeline was changed from 2 years to 4 years. Okay, so and then this is the other one, and as you can see, this is a placeholder. If you're not familiar with these kinds of forms, it says placeholder, and then the box is checked yes, and that's how you can tell that it's a placeholder bill. And so this is a bill that we may propose. It is a bill that we may propose solely for the purpose of starting a conversation. But one component of a highly functioning system of care in other states, which is just part of every really well-developed system of care, is a Center for Excellence that trains providers on whatever the strategic priorities are in terms of where the whole system needs to be adjusting or learning and growing together. So capacity development and continued ongoing education. So we have a number of entities right now that act in Oregon, act as centers for excellence for different types of training and capacity building within the human services space. This concept would create a legislatively funded Center for Excellence that would sort of follow the direction of either the System of Care Advisory Council or the legislature in terms of how they prioritize capacity building and training. So within our strategic plan, for instance, we have a whole lot of information around developing capacity for behavioral health providers to provide services to people with intellectual or developmental disabilities, and for IDD service providers to support young people with mental health challenges. And we need actual training and cross-training and relationship building between those two siloed entities in order to really expand that capacity. The Center for Excellence that we would create could be tasked with doing that work. So they may be providing affinity spaces as well as training and capacity development and actual CEUs, right? Not just like a webinar, but like ongoing continuing education credits for providers so that they can maintain licensure. Remy Watts.
I'm sure you can see this question coming from a mile away from me, Anna, but when you say providers within the human, like for training and capacity building within the human services space, would that include education staff, teachers, like sped staff and stuff like that, or would that be separate?
Well, if it's a Center for Excellence that the SOCAC gets to direct, then yes, it would, Remy. If it is a Center for Excellence that the legislature chooses to direct, then I can't make
No,
promises.
yeah, totally. Yeah,
And
no,
my
I
guess would
totally
be
hear
no
you.
because they're so hands off in the education space, but
I know it drives me up the wall. And ODE is also hands off about training teachers as well, which once again drives me up the wall. And also just like last clarifying question. So there are like a number of entities that act as centers for excellence, and this concept would create one entity. Does the logic flow through where the other centers, I don't know anything about the other centers for excellence that you're describing in this problem of practice or this problem statement. Does this insinuate that like whatever centers for excellence that the legislature funds that aren't centralized, would those all get rolled into this like one center for excellence that you're imagining?
unlikely
Okay.
because they have a variety of funding sources, and as long as they can like maintain their funding and continue doing their work, like, it wouldn't like ban other centers for excellence from continuing to exist, right? But it would be sort of one centralized location for this cross-system center for excellence to really focus on developing the system of care via the model and philosophy that we espouse, as opposed to sort of catch as catch can.
Thanks, Anna.
Any other questions? Welcome, Meg Carey. Meg Carey has just joined us. She is the OHA Medicaid Behavioral Health Director. If you want to say anything else, the only other thing we said in our intro was our pronouns and our one goal that we have for this meeting.
Chat. Thank you all.
And Selby has a hand up.
Yeah, I have a question similar to Remy's, just about kind of the plethora of councils and things we already have going on. Right, something's tickling my memory. Like, wasn't a couple years ago, wasn't Governor Kitzhaber trying to establish something similar? I remember he was giving, I saw public presentations he gave that were very similar to system of care in concept. I don't know. I just feel like this idea is tickling my mind from somewhere else. And so I'm just trying to, again, understand like what the current environment is. That's not ringing a bell for anybody else. Okay.
Is it ringing a bell for anybody else in the room? That Governor Kitzhaber Centers for
It's been
Excellence?
many years. It was funny. I was actually at a conference with Chelsea, and we heard him, and we looked at each other like he's talking about system of care. But anyway, I don't know. So I'm just trying to understand the current environment. Like, I'm not opposed to this idea of a legislatively funded center of excellence for children, but again, I'm trying to understand the wider landscape that you're proposing this fit into and trying to understand. I mean, I guess I presume there's no duplication or you wouldn't have proposed it, but I'm just kind of really curious about the wider environment.
Well, I love the credit that you would give us on that, Selby. I don't know that it's true. My understanding is that there are some overlaps and duplications existing already. And I believe that OHA, I don't know, Hillary, if you want to say anything more about this, is doing an assessment on sort of the centers for excellence that they are partially funding in a variety of ways, and how there may be duplications and overlaps, and whether there's an economy of scale to be able to find there. Hillary, is this ringing a bell? It looks like maybe no.
Yeah, it is ringing a bell. I mean, we've got centers of excellence for wraparound, for our ESA services, and so we are inevitably looking at everything that we do at the moment. So
we may find duplication of efforts, Selby, and that's something that like this bill is maybe intended to be a conversation starter around how many different centers for excellence are we funding? Should we be funding them the way we're funding them, right? I don't expect that we'll see new funding coming out of the legislature for a Center for Excellence this time around. And I still think it's worth having a conversation about our strategy here in Oregon, where we have not only siloed our services, but siloed our capacity development strategies around those services so that we're not cross-training folks really at all. I see your hand out, Anna.
Actually, I think that you answered my question, which was about whether it would be new investment or carved out of existing investment. So it sounds like
It would, if we did it, it would take money from the council, general fund from the council itself. So decrease our continuing service level budget and redirect it. There are folks in the government relations world who are very afraid that if we put that on the table, what the legislature will say is, oh, they don't need that money, and they'll take that money from us, but then not reinvest it in Center of Excellence. And so the recommendation that came from those folks who were concerned was that we just do a contract to create this sort of cross-training system of care version of Center for Excellence. And maybe that is what we end up doing. So that's something maybe you all could discuss in your small groups as well, whether you think that's helpful. And then Hillary is saying Governor Kitzhaber had a proposal for Southern Oregon, and it's kind of connected to that Southern Oregon success work that really is system of care E. I know he's involved in that Jackson County, Josephine County system alignment work that their local SOCs are involved with, but is broader than that. So I am going to put you all in small groups, like for. Let's see, we're supposed to finish this at 3:55. Let's go for 5 minutes. Shortening this a little bit because we're a little bit behind on time. And I'll pull you out and you can do quick report outs. And again, we can have this conversation again. So this is just a first reaction kind of concerns and thoughts, suggestions. And I'm just going to randomly put you into breakout rooms. And let's see, there'll be smaller groups, so 3 to 4 participants per room. You should see a little blue button that says join. Those of you who are not voting members, feel free to participate in the conversation or stay quiet. Whatever feels better for you. I'm going to pause recording just so that those. They must have recently changed Zoom where it doesn't like scream at you that the meeting is being recorded every time you turn on recording. I just turned recording back on and was not accosted by the loud announcement. This meeting is continuing to be recorded. Okay, was that not enough time? Usually when nobody comes back until the room automatically closes, it means we did not give you all enough time to have the conversation.
It was pretty short.
Nate?
I was gonna say it could be helpful to have more time just to talk about, especially around like the Center for Excellence and a little bit of that, and just like I think overall, I mean, this sound like we're not on the like short like time scale for it. Just getting more like context on like potential implications, like hearing from folks that provide like essentially what that center would provide, hearing from the folks that currently provide that, just to see like what gaps it would address, things like that. I think just overall more context was a common theme, but I would be curious other folks from my group.
Awesome, thanks, Nate. Leah.
Yeah, say ditto on that, and just a better understanding of who it would encompass, whether it's just system of care or if it's kind of youth behavioral health as a whole, and just a lot more clarity on that piece.
So do you want to go back and have more 5 minutes more? We can we are the masters of our own universe here, folks. We can just skip the prioritizing our focus for this time and put it on our next agenda. And when we're done with this conversation, I can give you some quick updates on the committee charter, or we can just plow through our agenda and come back to this in the future. Debbie?
I think for me, I would need somebody to present more information about Centers for Excellence. Like having further discussion when none of us have the context for me is not going to
Wouldn't help
a lot
you.
more today.
Okay.
But if there's somebody that is an expert or knowledgeable that could come in and kind of share, this is kind of the idea behind these and how they work and how they operate, and the impact that they have, that would be super helpful. And then
Gotcha. I see other nodding.
I do have a small note too, if you're looking for other things in the LC.
Mm-hmm.
In 978, where it lists all the membership stuff,
Mm-hmm.
there's a reference in KII that's Youth Criminal Justice System, and then in LII, it's Juvenile Justice System. So we probably just need to pick one.
In KII, it's criminal.
Youth Criminal Justice System, and in LII, it's Juvenile Justice System.
Gotcha. Thank you.
Yeah. And maybe there was a different intent by that, but it seems like it's referencing the same thing, so we might just want to use the same.
Yeah, I'll totally just like look at it and then come back to it. But thanks, Debbie. That's really helpful. Remy.
Yeah, I mean, Debbie and I were actually in the same group, but I was going to ask for a lot of the same, like just the context around what are the centers for excellence that exist right now, how do they work together currently, and like also, you know, I know that you already kind of breadcrumbed this, Anna, like we know that this isn't going to happen in this next legislative session. What is the goal that we're trying to achieve by putting this legislative concept forward? We obviously want to get a conversation going, and what is the successful trajectory of that conversation? Is it more collaboration between the current centers for excellence that exist right now? Is it more collaboration on workforce training in general around our shared population? Like, what is the goal that we're trying to achieve with that? And how do we orient people around it while also knowing that we're probably not going to get what we want in this legislative session?
Awesome. Those are great questions. Thanks, Remy.
Anna.
Hillary.
So from my group, there was we were starting to talk about the removing of the DRO and broadening it, and we could really do with some pros and cons and a little bit more information, just to again make sure we weren't missing part of the picture. We just needed a little more than we did as a team.
Yeah, I'm happy to bring that. I mean, the short answer to that is that Disability Rights Oregon received some federal funding cuts and are no longer able to staff the position with somebody who has leadership and decision-making power. And so they asked if they could put a person who's sitting in a fellowship in that seat, and it does not feel fair to me to ask them to continue to make the same level of investment that like agencies with billion-dollar budgets are making. When they do not have the same level of funding stability and are not able to really continue to staff with that level. But if they are able to sort of share that across OFSN, OCDD, those other sort of federally mandated agencies, that maybe will help them all carry that burden a little bit better, because somebody may have funding or may be interested and somebody else may be like, blah, we're tired of this, we need to step back. Right. So the intent was just to create a little more flexibility actually for those different entities themselves.
Okay, and maybe you'd said that and we were all late to the room. So, okay. So
I mean, I did talk
now
about
it
more
makes
flexibility.
perfect
I didn't
sense.
talk about the funding piece and why, like how the
Right.
idea originated, right? That wasn't, I didn't put that out there the first time.
Thank you.
You're welcome. And then Sylvie put in the chat that she expected that if we would fund this, we would decrease grants to the local systems of care. That is not the case and not the intention, and those are two separate pots of money. Want to just be really clear about that, not put misinformation out there that system of care, local systems of care, would be worried about. Could we circle back? Just sticking. If the SOCAC budget is funding the Center for Excellence, what are the potential impacts of SOCAC functioning with this diversion of funding? Yeah, I mean, it's just a matter of like, there's sort of a benefit drawbacks conversation, and maybe we come to this, you know, more in depth in a future meeting. But if we're funding it, then we sort of have complete control over how it functions. So it would be specifically aligned with the SOCAC strategic plan, which could be fun. And it would be, you know, my estimates and research looks like it's about somewhere like $250,000 a year that would cost to really fund a functional and well-staffed entity to do this work. There are a few that already are doing similar work that could be expanded to cover this, right? We wouldn't be building something from scratch. And we have about $900,000 in our existing budget for this biennium that hasn't been expended yet. So it really would not, or hasn't been allocated yet. So it really would just be using that unallocated portion of our budget to make a strategic investment that would help grow the capacity of the system as a whole, which I think is our job.
Hey, Anna, this is Alex Solis. Regarding the Center of Excellence, and sorry, I was trying to raise my hand if somebody's ahead of me. I just can't find the ding button because I pressed something on my
really?
screen and it just shifted around. But that's my problem. I'll figure out Zoom
We don't
someday.
have to be as formal. You can just unmute and talk.
All right, thank you. I appreciate it. I heard some thoughts that kind of went around what I was thinking on this too, is, what's the ultimate goal there? And kind of from what I was reading, it feels like coordination, creating a portfolio or a catalog of trainings that addresses the needs and gaps and opportunities within the system. And just want to throw this idea out. And I know we're no place towards a solution, but I just thought some framing might help in the sense that maybe there's so many centers of excellences around Oregon, or those that sit on the cusp or the outskirts of that, who may very much during a session say they are a center of excellence, and they very well are probably. That maybe it's more of a coordination effort to certify them that they have equitable, thoughtful, culturally competent care trainings, and so forth. And that the bill really helps coordinate all these different entities, certifies them, supports their CEU credits, and provides one portal in which all trainings can be obtained. And then it's more of a curation of different trainings, whether it be child welfare, behavioral health, and then putting that golden string between all these entities. And so as opposed to creating, booking, and logging, you let them do what they do well, and you help curate it in some way so that there's a golden thread between everything.
Okay, interesting. That's a good idea, Alex, and it is we'll bring it back up for further discussion in another conversation. Another question in the chat: would love to know if youth sex offender treatment and providers would be included in the Center for Excellence LC. I don't know that it would be necessarily in the legislative concept, Sonia, but what I think would necessarily be a part if we are sort of directing how the investments are working. It is a massive gap, and it is actually part of the 4086 Children with Concerning Sexual Behaviors or Complex Sexual Behaviors report, that we need to fill that gap as a system, and that it isn't any one system's responsibility to fill that gap. So I would say that would be like an excellent way to sort of use the center to expand the capacity of the system as a whole. It's a known gap that is causing harm across the system. I don't know if there's more you want to say about that, but I get all worked up about that particular issue. So sorry for getting all worked up. Nate wants to know, curious if we created the Center for Excellence, would local systems of care have connection to it, or would it be entirely separate? Local systems of care would have connection to it in the same way that they have connection to like this work, Nate, where they would get to see what those trainings were and weigh in on recommendations for additional, right? That there would be like dialogue and information coming and going back and forth. Is that what your question kind of was driving at, or do you want to say more about it? Oh, you just moved.
Oh,
there you
I don't
are.
know where I moved to, but I'm here.
I see you.
Yeah, that was essentially just my question. Like, what capacity would that look like? Were they like purely receiving information? Is there like a dialogue where like it would help like influence like what like local system of cares are hearing? Would that influence some of like the different trainings that come up? I would imagine so.
I would hope so.
I just
Yeah,
figured
yeah.
I'd ask. Yeah. Thank you.
Yeah, but putting it on the record, Nate, good idea. And Remy, how do we coordinate them to work smarter, not harder? I think that's along the same lines as what Alex Solis just mentioned, right? Maybe there is a better sort of coordination and oversight role almost in that work. Selby saying cost benefit analysis could include funding the center versus funding local programs. Selby, are you talking about local service delivery programs, or like paying for local programs to get different types of training?
I'm sort of channeling one of my fellow system of care coordinators, and whenever these kind of discussions comes up, she's just always like, fund local programs versus, build this thing or that thing, or create something new. She's always like, just fund something locally so we can get it done. So I guess that's just what I'm thinking about when you said it's about $250,000. Again, I'm not saying I'm opposed to the Center of Excellence idea, just presenting. I could hear this other coordinator in my voice saying, well, that could fund a lot at the local level and just fund the local programs, and I know you have a strategic plan there's a lot of things you want to implement or that we'd like to implement that could include, funding behind them. So just kind of weighing different choices or ways to make change, so maybe it's that idea if we had a more clear idea of what we would pull in from the center, it might help us understand how then we could use that to then maybe improve local programs in a different way. I don't know, but yeah,
No,
just trying to weigh those. Like, so that we have one fellow coordinator who's a great advocate for the local level stuff. And I can hear her kind of in the back of my head.
Gotcha. Yeah, we can talk about where the balance may fall on that. And I think, part of all of this work sort of, right? Like if we're doing policy generation within a committee space, like where does it start and how do we continue to make sure that folks feel part of it? Like it can't be too well defined or y'all didn't help co-create it, right? And so like we do have to sort of start in a nebulous place of like, here's an idea. How would we refine and direct that idea into something? If we're going to do this in a policy committee space, right? Like I think so this is, like I said, the beginning of the conversation, getting lots of really good questions. I'll go through the notes and pull them out, and we'll come back to these questions and add more detail, and then react to that detail. And then Corinne says, "Wonder if it could be." Having a little bit of hard time with maybe a typo. Housed in one of our Oregon universities, like the other states that have great university resources and support, like University of Washington, I'm guessing. Not University of Wyoming.
Oh, good call. I guess there are other schools.
That's my UW, but I grew up in Wyoming. I didn't know there was another UW until I moved out here.
That's so funny. And like, yeah, obvious. Yeah, I mean, just kind of generating ideas, but to Selby's point, celebrating the localness. How can we keep it in the home, keep it in Oregon, things like that.
Gotcha. Yeah, something like the Yukon Innovations Institute, but a local version that really responds to local or statewide needs for capacity development.
I wanted to mention one other thing. We talked about this a little bit in our group too, kind of the same thing that like Alex was saying about looking at synergies and really trying to think about coordinating and looking at again that there's a lot of times big centers of excellence, and again they're often underutilized. But I think back to sort of like where does this sit? It goes back to the workforce shortage, right? So we end up not having enough people to even do services, right? And then, the same people end up being in a lot of the same spaces. So again, like, are we going to then pull people from other things we need them to do to service this, the kind of the center of excellence? So is there other opportunities back to keep it local? Yes, but are there also things you could lean into, whether that's from a national or like from the college or, you know what I mean, like a different space to pull some of these resources from versus the same people that are in pretty much every other space, if that makes sense.
Yes, it does. And that's a great point, Courtney, particularly from Oregon having we're smaller, right? Like we often compare ourselves to California and Washington. Washington's state budget is 5 times the size of ours. They have a much larger population than we do. They have a larger provider network as a result, right? So I think I personally see that happening a lot with the when we're looking for tribal representatives, and some of those poor people who are representing tribes are like just in committees all freaking day because everybody wants a tribal rep on their board. And so we're really like diminishing their ability to do the work that they exist to do because we're asking them to come speak to all of these different groups about the same thing over and over and over again. So really great point, Courtney, about kind of not overdoing and not asking more than the small system we have can have capacity for. And then Hillary in the comments, also the free National Training Technical Assistance Center supports that are often underutilized. I don't know, Hillary, if there's anything else you want to say about that.
just that the federal government's paying for it. We may as well use it. And they do a lot of supports that can be, they have a lot on websites and can also then often do specials as needed. So it might be that we can, with the right asks, get those services without having to pay particularly for them and ensure that other parts of the world get to see them too.
Yeah, that may be the right way to go. Anyone else wanting to say anything on this topic? I'll put this together in the notes and get them out to you in ideally a more timely fashion. We are struggling with capacity at the SOCAC, being 50% staffed at this point, so I am sorry for communications delays. But good news, our communications person just finally got approved at DAS after getting passed in a bill in 2025. So maybe in 2 years they'll be hired. Nate.
Yes, thank you. But exciting to hear that that got approved and all that's moving forward. Nice. That's great to hear. The only question that I had, just because it's something I just want to think about outside this meeting space about that Center for Excellence, would it be, and I think you already touched on it, so I apologize if it's a reminder for me, is it purely training focused, or what would it, like, I guess, like, what would the scope of what that particular center do? I think that's the main thing is training, but I was just wanting to make sure while I thought about it.
So, I mean, it would be primarily training focused. That's what nationals, or that's sort of what the model is that we've been looking at in terms of how do you build a high functioning system of care, and one of the gaps that was identified when we did kind of our system of care assessment a few years ago. That said, I think there's also I have personally have some interest and would be curious in a future conversation about this to hear what other folks' level of interest would be around creating some like practice or implementation support groups. Like we often do, like, hey, here's a new skill we want you to go use, and then folks go back to their job. And it's really hard to implement that, right? So if you have sort of more ongoing support where people are actually talking about, I tried the skill and it didn't work, or it worked in this way, and then they're reflecting on that with people who are trying that same new strategy in similar contexts across the state, I think we might actually see better change happening on the ground and like find out what's really working and maybe adjust our strategies as we go. So that I would love to have some sort of implementation support at the center as well. And I saw your hearts, so I think you probably agree. Okay. So we only have 16 minutes left. That doesn't really seem for me like time to prioritize our focus. What we are supposed to be doing for the last like 40-ish minutes, which we weren't doing, is prioritizing our focus for a high acuity topic around preventing or ending or reducing the rate of temporary lodging in Oregon for kids who are in child welfare who don't have a safe and appropriate placement, and prioritizing some strategies around community-based care. I would like to propose that we instead dip back into the charter and I update you on the changes we made last time, and we come back to this prioritizing exercise next time when we have more time to dig into it, and maybe I'd be less ambitious with our agendas moving forward. Thumbs up. Okay. Let me pull up the edited charter. Oh, I like the explosions of thumbs. I don't know how you do that, but. Okay. So I think I put a PDF of it and it didn't include the comments, but I want to show you this. And again, I'll send this out to everybody after because I put comments of who requested the change and where the change is. And I think that will feel better than just seeing that the changes are here. So let me open that. Double checking that it actually has the comments. Okay, great. View, one page, expand. Okay, and this is maybe helpful for those of you who weren't here last time because then you get to see the charter itself. So quickly, I'll click over. These are the notes of what people said, and this is what I'll be using to kind of guide us as we walk through this. So here is our charter. Here is our purpose. Here are our specific expected outcomes and deliverables. Alex Palm in the last meeting had requested that we identify how we determine when a task is complete. And so what I put in here was determining when a task is complete will fall to the committee. That's a sentence I could edit. We're working to solve adaptive problems which are complex and evolving. While a specific problem may not be solved, our authority or capacity to make progress may reach a clear endpoint. When that occurs, the co-chairs will bring a decision to the committee to call the topic resolved or partially resolved and conclude work on the topic for the time being. We reserve the right to bring back topics to the table once identified as resolved should a new need or strategy to improve resolution be identified. Any member may request to reopen a previous topic. The decision to reopen will be made by the co-chairs and the SOCAC Executive Committee at the monthly exec meeting. Knowing Alex isn't here today, does that feel okay to folks? And I'll send this out so that if folks are like, well, that's not what I wanted, they can point it out.
So I think that was actually Alex Solis, but I also give Alex Palm all my great and bad ideas too. So
Oh, see? Okay. Well, do you feel like we reached the definition of done that you wanted to see there?
yeah, that's kind of like the goal I was looking for on that. But yeah, I
Okay.
mean, not
And
as
it
to
does
an
just say
output,
Alex.
but
I don't know why I assumed it was Palm instead of you.
I mean, again, give him all my great and bad ideas so he can take the blame for everything.
And then Debbie requested that we clearly define timelines and deliverables. That's kind of hard with this like really complex work. And so we'll identify goals for completion with each step that we're sort of focusing on and track our progress toward completion via our monthly meeting agendas. And then we also have this larger strategic goal tracker that Christy is working on building with some folks who are better at Smartsheet than me. And so like that is also going to be periodically reviewed of like how close are we all to achieving these goals that are set forth by the council and how are they tied to the work here versus the work in other committee spaces. So Debbie, that's lots of thumbs up from you. Okay, thanks. The next one, this was a request by Selby that we add a what did it say? Selby requested calling out agency partner roles, how we will get work done, adding a section called how we will get work done. I did not do that, Selby, because the charter is consistent across all of our subcommittees and the other subcommittees don't have a how we will get work done section like separate on that like blue column on the left. But so I just made it a heading within the meetings and procedures because procedures is kind of for me how we get work done. Does that like feel responsive to what your request was, even though it's not exactly the same, just in terms of how I added it?
Yes, I'm not stressed if you added in a column called meeting procedures or an independent row titled how we will get work done.
Gotcha.
So
Okay.
the placement wasn't really the issue. The desire was just more that we have a commitment from our state partners towards action because SOCAC is limited in its actions based on its formation as an advisory group.
Yeah, so and that suggestion actually lives somewhere else, but this one was sort of like, how do we know how the work is getting directed and how is it getting bounced back and forth? And so there were two different comments of yours that I went back and reviewed, Selby. And so this one talks about the co-chairs partnering with the executive committee and figuring out how committees bounce work around. So work we're doing in this program and policy committee may then be bounced over to our investments and finance committee if it's about, say, funding a Center for Excellence. Right, we would make a recommendation to the Investments and Finance Committee that they go ahead and fund that thing, right? So that would go through our executive committee space, which is all on YouTube, and many of us are in all of those spaces. So that's what I put into many, many words here. And we'll get to the other one down below, Selby. So in this, Lacey and Hillary wanted to make clear that there are times when agency staff can't take positions on things, particularly changes to Oregon revised statutes or administrative rule without permission from the governor. So we added for recommendations regarding policy changes, agency staff may need to serve as subject matters experts as opposed to voting members. When this occurs, agency staff should identify their change in role by stating so out loud during the meeting. SMEs, or subject matter experts, can provide technical information regarding policy changes, but cannot take a position in support or opposition of the recommended policy change. Agency staff are expected to help identify when policy change would be required to accomplish the stated goals of the committee and advise on whether the recommended policy change would address the concern the committee is attempting to resolve without taking a position on whether they support or oppose. Conflicts of interest should be stated clearly by all voting members prior to voting, and anyone identifying a real conflict of interest should recuse from the vote. And if you have a question about the difference between a real conflict of interest and a potential conflict of interest, that is part of my nerdery that I would be very happy to sit with you and explain. There's a real difference and it's an important difference, so feel free to reach out if you feel like you have a conflict of interest. If you have a conflict of interest in Oregon, what it basically means is that you're going to make money from making this decision. You or someone who lives in your actual physical household will make more money because of something that we're doing, or make less money because of something that we're doing. We'll be like directly financially impacted. Anything else that you might think is a conflict of interest is likely a potential conflict of interest and does not require you to recuse. Debbie, I don't know if I just interrupted you.
You did not, and I appreciate the extra because I know that that's a confused wording all the time. And I'm just wondering on the beginning of that sentence if it should say potential conflicts of interest should be stated clearly, and then the real conflict in the second part. Because otherwise, I was like, well, what's the difference between conflicts of interest and a real conflict of interest? And it's because it's the potential part. So,
yep, thank you. So the potential and then real, does that read right? Thanks, Debbie. I feel like I was really struggling to get that into words, so that's really helpful. And then this is the other piece, Selby, that I think you were looking for earlier. So this is agency partner. This is in sort of the roles and responsibilities section. Agency partners are expected to support implementation of recommendations issued by the subcommittee and the council. When implementation is not doable, agency partners are expected to share information about why implementation is delayed or not possible. Does that, okay. I love the hearts. That meets your recommendation. All right.
Can I ask a question? Could you go back to that one? I guess that reads, so there might be times where the recommendations are not agency policy or that the agency can't support. I'm just concerned that that expectation word could be big. I'm just thinking if you said, you know, something should happen on temporary lodging and child welfare it doesn't agree with the advice they're getting from DOJ, then they wouldn't be able to support that. I'm just trying to think of it. I'm just thinking of the reality of sometimes there are some barriers that a agency might not be in agreement with a recommendation from the council.
So, and I totally hear you. What I was trying to do was this sort of second part, like when they can't implement it, tell us why.
Okay.
Does that not address the, like, if we say like, hey, Lydia, you should be doing X, Y, and Z, and DOJ is like, hey, Lydia, you absolutely cannot do X, Y, and Z, that Lydia would be able to say like, I hear the recommendation. I understand where it's coming from. I'm not able to implement it because of specific advice that I've gotten from another partner or whatever. Like, she doesn't even have to say DOJ said no, right? But she can say I can't do it because I've been told it's not implementable or whatever, right? Just so that we're transparent in the space about, like, I think there's a lot of times agencies can't do things and we don't tell people why we can't do things, and then people think we just don't want to, and that diminishes trust in the work across the board.
True. I'm just sitting with the second half of the sentence to check. I think we can live with that. I don't know whether anyone else from an agency has an opinion. If this was at odds with something.
Agency friends, feel free to take a look and run this up your chains. I will say that I am relying on this letter from Director Wendt, Director Hothy, Director Williams, and Director Tassine that says that they direct their staff to implement the strategies of the System of Care Strategic Plan. And as long as what we are recommending is in alignment with the strategic plan, we should have broad alignment. We may not have explicit alignment, and we may need to figure out how we address those things. But I
Right,
think
it's not in our
98% of the time we're going to be swimming in the same direction.
yeah, it's not our intent to get you in your way. It's just yeah, the semantics.
Understood. And Hillary, if there's concern from OHA leadership, do feel free to circle back.
Thank you.
Okay. So I did send these out. I know Selby's not getting invites, but this is also here. So this is who said what and how I made sure. And then you will get all of this in your meeting follow-up, and I will send it by email and not just by calendar, because I feel like it's what I'm hearing is that calendar stuff is not always working. I see a few more comments. Learning collaboratives. Yes, Anna, that was the word I was looking for those implementation supports. And Nate, regarding timeline goals, if a timeline isn't met, there's a contract or a description for why. Yeah, that's a good idea. Yep, and federal conflict, I think we're going to have to continue to name those things, right? Like we want to do these things, but we can't because federal government doesn't allow ODE to do blah, right?
Yeah.
Or whatever it is.
And Anna, I'll tell you this up front. Special education policy is like one of the most nuanced, difficult to understand policy arenas I've ever found myself part of, and I will do my best at translating. And I have multiple colleagues who I have regular touch points with, and I'm going to do my best to make sure that we're not going against federal IDEA. But
As will we all.
Yeah. I don't want to talk about it.
But so one of our values that is not one of my personal values that is not in our group agreements, but maybe I'll advocate for it to be, is learning in public. Like I think that like we have this sort of expectation that like agencies already know all the answers and they're sort of keeping them a secret. And I think if we can all kind of commit to like changing our minds and learning and growing together in community over time, that like we will do better if we're like, oh, I didn't know that. I can accommodate that, right? And like, Remy, I expect you to learn in public and like make mistakes and have to come back and be like, I thought we could do the thing. We can't do the thing. That is fine. I think that humanizes all of us as agency representatives out in the world and also gives us a chance to make mistakes as whoever we are in this meeting. So I hope you can feel confident to like screw up and then admit you screwed up and we forgive you and welcome you back and just keep moving forward. And that's not just you, Remy. That's all of us. Okay. Well, thank you all so much for your time, your commitment. We'll have another agenda out hopefully by next week. If you have questions or comments, my inbox is always open. Take care and have a good rest of your day. Bye.
Thank you. Bye.
Thank you.